Welcome back, everyone, to the Milk of the Matter. My name is Dr. Alison Bernard, and I'm the Executive Director of the Breastfeeding and Child Nutrition Foundation. And today I have with me Dr. Heather Harewood, who is a public health expert specialist, and she's also a University of the West Indies CAFL campus lecturer. Hi, Heather.
Hi, Alison.
Thank you very much for being here today with us.
I'm happy to be here. Thank you.
Right, so we've known each other a while, and I have always been curious about why you decided to be so dedicated to the issue of breastfeeding and public health.
Okay, that's a good question. Several things I would say have fed into that, but I'll probably start with work. So I did another life when I worked at another institution because I spent many years working in the public health care system in Barbados.
Right.
So specifically, my first attachment was in the maternal and child health clinic. So I was literally, thrust into the hot seat, so to speak.
Right.
But what I found intriguing was the sort of emphasis that was being placed on mothers and children and supporting their nutrition and healthy development for children, but also focusing on safe motherhood and really trying to maximize the health of persons who were coming to the clinic. Of course, there were a number of additional things that we did apart from provide, say, antenatal care, and I got involved in that. So we would have, say, breastfeeding clinics at the time, they were called that.
Right.
And of course, we always tried to invite fathers. It was not just for the women, because we recognize that raising children is a partnership.
Fair. Absolutely.
And we also had adolescent health education programs and displays and different community activities that really piqued my interest. And then you recognize, because you were able to hear from people where they were living and working, some of the challenges that might have arisen. But importantly, I think some of the successes that people had, because there was a strong emphasis on peer education.
Peer education.
Peer education.
Okay.
So we would have mothers who were successful at breastfeeding. They would come back and be a part of that.
And teaching mothers.
And teaching mothers. And I found that the response was really positive from the mothers, because it's one thing to be the professional saying something, but hearing from someone like yourself who you identify with probably more.
And who's experienced it as well.
Exactly.
Yeah.
So I think for me, it just was a natural affinity. And actually seeing mothers come in, they come in really tentative at the start of the program. So we might run it for, say, 6, 8, 10 weeks. By the time they were finished, to see the sense of achievement. So for me, that was, I would say, kind of a positively reinforcing activity. And also from the other end of it, knowing the importance from the academic side of it, of breastfeeding. And the importance it is for developing your child and setting a good foundation for the rest of their lives. That was important, I would say. So having gone further into academia, being more engaged in the evidence, that kind of just fueled my desire to be more involved and to share what I know. And I definitely enjoyed working with mothers and their children. And I think from a personal point of view too, as a mother myself, breastfeeding was important for me.
Okay.
And interestingly, parents would say to me, "You have children?"
That was the first thing.
Do you know? Yeah, because it almost it was a different resonance with them. If they could think that you could share their journey, notwithstanding, not all practitioners may be parents.
Absolutely.
But I just found, for me personally, that was an important thing. It was an open discussion in our home growing up. So I just thought it was just something that came naturally, I would say.
So basically, it started off maybe with the practicalities of breastfeeding and seeing how mothers engage with breastfeeding and what we were doing as a system to a system. And then when you had your own children, you found that kind of fuel. Do you think it fueled your passion, maybe? I dare say passion. I don't know if it's passion. But your passion for breastfeeding and public health even more?
Well, I think I would use reinforced. And, I think being able to share some of the challenges with mothers as well. So they recognize it as something that happens across the spectrum. It's not just, at an individual level, but that across the system, mothers in many countries have their shared challenges and their shared successes, and just being able to learn with each other, I found was important, because I think an important part of public health is actually co-developing knowledge with our patients and co-developing solutions. So for me, as I said, that was important, because then you could see people actually getting a level of, I would say, self-efficacy in breastfeeding. Some were better at it than others. I mean, you always have a spectrum, but I think it's something that you can see the benefits, and I believe in the benefits. So, yeah, I think those were the reasons.
What do you think about what we're doing in public health now as it relates to breastfeeding? And because they're saying right now, over the last 30 years, there hasn't been as significant a shift in breastfeeding rates globally as you would want.
Sure.
What do you think we are doing now to kind of shift the needle, or what more do you think we need to do? to shift the needle?
Well, I think it's important to recognize that successful breastfeeding does not rest just with the parents. So if we look at it from a system-wide perspective, I think we can identify different things at different levels. So in public health, we speak about this model called the socio-ecological model. And it really allows you to examine a problem looking at individual factors, community-based factors, and societal factors, for example. I mean, there are different models. So some people have, different words seen as concentric circles. But importantly, so individual activities, your interpersonal relationships within your family, or in the wider community, or say at the business and commercial level and the policy level, these all have implications for how people can breastfeed and be successful at breastfeeding. So maybe in shifting the needle, I think the focus needs to remain on the mother, but I think we also need to look at some of the wider factors that can be supportive.
You and I are on the exact same page. We do have a tendency to, the women have the breasts, so they're the focus of attention.
Right.
But it can't be if we are not providing the environment for them to be able to make that choice.
Exactly.
And I do see in practice as a counselor that a lot of these moms really, really want to breastfeed their babies. I don't know if you have the vast majority of them.
Yes,
but their scenarios don't always allow them to.
Agreed. I do believe, even based on some of the research we've done, there's this definite interest in breastfeeding. And sometimes then there's a tension even within the home. So if you go from, you have the mother who might be willing or interested, she and the partner, she and her husband, whoever, they're interested. But then sometimes you get this tension with what culturally and traditionally they might have been hearing from, say, the grandmother. So, there's some very important levers of power within families. And sometimes that can be part of the problem because it's like, you need to feed my grandchild well.
Right, yes.
You're starving my grandchild. So sometimes even just trying to put forward the evidence or the information, but no, the baby's fine, crying is okay because he's not wet, the belly's full, I just fed him or fed her. So I find sometimes those are some of the challenges. So again, if you can get, responses that incorporate some of the discussions that come up in the home, and then certainly within the community, I mean, I find there's general support based on the research we've done, where people will encourage mothers, you're doing a good thing. But I find that it tends to wane as the child gets older. So people tend to be more supportive if it's a tiny baby in arms,
and
but maybe not so much a toddler. So despite what WHO says, breastfeed up to 2 years, sometimes that does not get quite the level of support. And then, you can think about various institutions, health facilities, daycare facilities. But at the policy level, workplace environments also need to be conducive for mothers who are breastfeeding to be able to, if it's a case where the child can't be brought or, there's not a creche area or a nursing area, but at least to express the milk and to store it. So there are a number of factors that if they could all be aligned. So if you go back to this Swiss cheese model that we all looked at in COVID, we're going to use it in a positive way now.
Yes.
If we can get all these factors to line up, then I think we will have a lot more success in breastfeeding being initiated, but not just that, being established and to continue at least for the 6 months. That is the recommended minimum.
And I agree with you. Right now, we do have some of the pieces of the puzzle in place. We do have. And I think for the longest time, I remember being an intern at QEH and everything was breast is best, breast is. So we have been pushing that ideology for a very, very long time. It's not new for us at all. But it's just the other little pieces that need to slot into place to allow mothers to be able to do it in the way that that is recommended and the way that they really do want to do. So still, because I still do feed, breastfeeding is part of the food system. I mean, it's a first nutrition, is being produced, manufactured just by a human body. But moving on to, I guess, more recognized food systems, can you kind of explain to us the significance of that link between food systems and the health in the Barbadian context?
Okay. Maybe I'll just say a little bit what a food system could be thought of simply, because system implies that there are more than one, element involved. And it's really a complex interaction of producers of food, mothers included, if you incorporate your definition, but those who produce food, who retail food, who consume food, and then also I would say superimposed on that becomes things like the marketing that is associated with food, and also policymakers, because policy determines what sometimes what sorts of food might be available, etc., the cost of foods. So there are a number of factors, but all of these, if you look at these 5 elements, they essentially interplay from production to consumption,
right,
and shape what might be available. And I think in terms of influencing the health context of Barbados, you know, it leads us to the whole idea of food security, a term that we hear about a lot.
A lot.
But I mean, if you look at it at a simple level, it is really ensuring that people have access, you know, to food that is healthy, considered to be nutritious, and it should be a sustainable access to this food.
Yeah.
Because, you know, so it's not just having food for food's sake, but it must be a certain type of food that's nutritious and allows people really to optimize their health.
Yeah.
So food systems then essentially can be, you know, the maker or the breaker of food security within a context.
Yeah. And do you think then that we have let's say not an appropriate but an effective food system environment here in Barbados? Do you think that we have adequate food security? Am I putting you on the hot spot here?
Yeah, it's a bit warm, but so what I'll deal with some of the things that you brought up, and probably just explain a little bit more what shapes our food system, because like so many other small island developing states, and certainly within CARICOM, if we narrow it down to our region, we are net food importing countries.
Absolutely, yeah.
So essentially, a lot of what is available on the shelves, it's not made here.
Yeah.
So in a sense, you are, I would use the term, at the mercy of what is imported. And it's not implying that importers are not looking for good quality foods, but essentially you can only import what's available on the market, what's affordable, what's sustainable, because you don't want a product to come in today and then you don't see it again for another 6 months, for example, even though we know that's changed with the Ukraine activity.
Yep, absolutely.
But essentially, you know, being a net food importer, that determines a lot of what is found in the markets. And then there are some other factors too that shape the sort of demand. So, you know, manufacturers, importers are going to respond to the demand that's present. So we'll find that over time there's been a shift in, I would say, food preferences as well. So moving away from the from the traditional type foods, the more globalized food tastes. I mean, there are a number of factors that contribute to it. So even with the net food importation, you know, the agriculture has had like a relative decline. So even some of the traditional staples, you know, the cassava, sweet potatoes, those sorts of things, which are very nutritious and good for us.
Yeah.
Even people who want to buy them will complain there's never enough.
Yeah.
Right? So you will find that has happened. So the traditional agricultural output has fallen. And I mean, that's a very complex thing, but I will just, you know, deal with the things. Let's deal with it at the surface. So let's say there's not enough of the traditional foods. There's almost like a surplus of relatively cheap food, but you know, what has been found is that this is not necessarily nutritious food. So it might be energy dense, but but nutrient poor. So we have that kind of dilemma where you might be essentially starving for good nutrition in a plethora of available foods. So that's where some of the challenges will come in. And then the convenience of some of the foods, because we recognize that people work differently. We've lost our traditional extended family support structure. So, you know, even if children come home and manage themselves in the afternoon, it's easier to deal with a convenience food than with the traditional food. So there are a number of factors. And
also this concept of time and parents not having enough time and family members not having enough time. So even for my children, they're lucky in that I am quite flexible, so I'm able to provide, you know, nutritious meals for them daily. Well, I won't say the vast majority, but there are quite a number of parents working today. For example, I've met a few of them. They're working shift in the hotel, shift in restaurants. They don't have the time to be able to provide those nutritious meals. So as you say, they go for what we define as a fast food, the ultra-processed foods that, as you said, energy dense perhaps, but definitely nutrient poor. And so what is the impact of this lack of food security on the health of our population?
So I think this is definitely identified as a driver of, you know, the overweight issue and obesity issue that we're seeing, particularly in our children.
Absolutely.
And, you know, within the region, you know, typically 1 in 3 children is either overweight or obese. I mean, there were some studies that were done here, albeit in 2011, the Global School Health Survey, but it did show that we have high levels of overweight and obesity among our children, and it's increasing. And I think we're all aware too that COVID now has added another layer of you know, increasing adiposity, let me use it, say that word, with our children, because, you know, people were forced to be indoors and, you know, so even those who may have had physical activity and some other things that may have been, you know, helping them to maintain their general level of health and even food choices, because you're home, you're bored, you eat. Food also is used, you know, food can also make us feel better, so it has mood altering. You know, so sometimes it's this perpetual cycle of eating. So we recognize coming out of the COVID-19 pandemic that, you know, that was another factor as well.
So, and you've touched on quite a lot of them, sedentary lifestyles, not eating nutritious foods, in terms of the impact on, or how it contributes to the rise of childhood obesity. But are there any other key factors that you can think of? I note one, and I can see it in my own household, this whole, and it feeds into the whole idea of sedentary lifestyles, is the technology and the absolute increase in technology, which I saw definitely happen in terms of my children over the period of COVID as well. And the impact of that on sedentary lifestyles, weight changes, eating habits.
Yes, and I think the irony of it though, so the devices can actually be used to help improve how we eat.
Absolutely.
And can be used to promote physical activity. I mean, so not dating myself by referring to the we, but, you know, we actually had opportunities where you could, you know, play tennis, you could do different things. And I'm saying there's a lot more advancement now in the technology. So, you know, you know, there are apps for exercising, you know, people can set up a Zoom meeting, they can exercise together. I think it is more for us to try to be innovative in how we're using the technology, not just looking at the negative aspects of sitting and doing nothing with it, but how can we now incorporate that? Because the other thing that happens, and, you know, if you look at it across the region and locally too, even within schools, though, the access to physical education activities seems to have got less compared to when I was in school, because I know there are some children, you know, you speak to young people and after fourth form, it's like PE.
They don't even know what the concept is.
No, so they know PE as a CSEC subject, but not for something for them to be actively doing. Whereas we engage in PE up to upper six. You know, you left school. Upper six, you're still doing PE. And I'm just saying that sometimes then is this kind of break in transmission, so to speak, where there's a decline in activity, you know, and formally it gets cut off. So it might just be focusing on people who are on an athletics team or some other sporting team. So, you know, these are some of the other things that we can think about. How do we get people to be moving and active? They don't have to be competitive, but just to do it for health.
So what do you think now, Dr. Harewood, about the push towards improving policy around childhood nutrition, specifically childhood nutrition?
Okay.
What do you think do you think we're doing enough? I know we have taxation on sugar-sweetened beverages, from the package warning labeling, all those things. Do you think that those things are effective? Do you think that, you know, it's going to have the impact that we want it to have?
I think they have the potential to be effective. And with any policy, with anything that involves, you know, human behavior, and as I would have, you know, alluded to earlier, eating is a complex thing. You know, because I didn't even, you know, specifically speak about the whole psychological reasons why we eat. You know, we eat for celebration, etc. And, you know, but I think there's the potential for the policies, particularly the school nutrition policy, to make a difference. But we need to look at what may be some of the constraints that people may have in actually being able to make these policies a reality for them. Because I'm sure you would have been aware of comments about healthier foods. So this is the other thing about the food system that I was going to go into. So thanks for this question. Sometimes the perception is that healthier foods
are more expensive.
And I use the word perception because sometimes it comes down to what you want to purchase as a healthy food item. So, you know, certain fruits are definitely, I would say, on the higher end, but, you know, should this make it the most of your basket? You know, apples are relatively cheap, oranges remain relatively cheap. And of course, we know our local fruits are very good, full of nutrition. You get them fresh off the tree. We recognize that they're seasonal, but I mean, we do have the capacity now to freeze things. We can take these same fruits and make our shakes with them instead of, you know, using imported frozen fruits for our shakes. So there are opportunities that I think if we can try, and again, this is why the policy will work, but it requires, I would call it a whole society approach. So how do we help the person at the individual level or the family level to feel that they have the efficacy to achieve these things? So, you know, more education, more opportunities for practicing these things. And even at a commercial level, you know, would a commercial entity decide, well, let's take our mangoes that are rotten and falling on the ground and turn this into something that's healthy. So a fruit shake, or, it could be something, but local fruits. So there's the opportunity, I think, for our policies to be useful, but, policy change and you've seen it affecting the outcomes will take time. And there can be this sense of discouragement because it's like nothing is changing but it takes time. So I think what might be important is to look at the processes as we go forward, not just focus on the outcome.
Right. Okay.
So if we can see purchasing patterns are changing, people are buying more fruit, or even within the school nutrition policy, so-called, snacks, as we call it, the things that in the bags that crinkle.
Yeah.
Some of them were identified
Treats,
that were low
really.
calorie, relatively low salt.
Yeah.
And there were still things that I think are widely acceptable to children. So again, promoting these and encouraging the consumption. So if we see changes in consumption patterns, at least we know we're going in the right direction.
And what I liked about what you said as well is your whole idea about debunking this idea that healthier foods are more expensive. It kind of depends on your perspective. As you said, if you're buying kiwi and blueberries and those fruits that really tend to be on the higher side, yes, it'll be more expensive. Buy your mango, buy seasonal fruit, buy what's in season, buy, indigenous fruits. And then if you make up your majority of your basket with that, and maybe once in a while you could buy a strawberries, if you can't afford it, then it won't be as expensive. But I think that's a really, really key thing, because I hear too many people talking about that. But
to be fair, I would add though, from work that we did, we actually found that, we asked people about their children know what their favorite fruits. And trust me, I will call it the imported fruits were the ones at the top of the list. So even when we are doing marketing, from the health perspective, when we show a healthy plate, and I mean we're moving more towards that, it needs to have a local fruit.
Yes.
Because a lot of the times,
as opposed to showing pictures of the blueberries and strawberries and so on.
Yes. So in a sense, sometimes this sort of paradoxical information creates problems for people as well. Confusion, yes.
Right. That's a really, really interesting. I'm hoping that people listen to this podcast and maybe their perspective on it changes a little bit, because we do need them to kind of buy into this.
Definitely.
Otherwise, we're spinning top in mud, as my husband would say. Right. So tell me, what do you think in terms of how does the local environment in Barbados play a role in shaping maternal and child health outcomes? That's one part of the question. I'll let you maybe answer that first.
So I think some of what we spoke about
before,
kind of speaks to that, in terms of there are some, several factors in our environment which can be best described if it collectively as being obesogenic or promoting overweight and obesity. Some of it goes back to the marketing that occurs of foods that may not be the healthiest foods. And I know, there's the whole concept of, there should be a limit of what can be marketed to children. Yeah. Because, the habits that you create as a child tend to follow you on into adulthood. Unfortunately, that also applies to overweight and obesity. So if you develop obesity or overweight as a child and you don't get a handle on it at that point, 70% of overweight or obese adolescents are going to become
adults.
Overweight and obese adults. So just to try to find ways to decrease the factors that promote being obesogenic. So again, what can be done for young people, starting at the early childhood education level. And if we draw on some things that have been done within the region, getting children to be more cognizant of growing things. So I'm not going to say they're all going to be agriculturalists, but to recognize that you can actually grow and eat the things that you grow. And container gardens, we can start with that. We speak about food security. I don't think container gardens will make us food secure, but at the individual household level, but it can actually improve the quality of the foods that you're eating.
Because imagine if you did not have to go to the supermarket to buy the vast majority of your fruits and vegetables. I would love to be able to just go pick my tomatoes and my cucumbers, which I eat copious amounts of, from my garden.
Yeah, but
how much money would you save?
You would, but but we need to look at some of the other challenges in our
time.
Not just time. We have issues with, I will say, a creature that some people think are cute. Some talk about the whole monkey population.
Oh yeah.
So for many people who have tried to start their little gardens,
and I've tried twice.
You know, sometimes it's the frustration of what do we do about the monkey. So, you know, we're not going to delve into that. That's another podcast. But I'm just saying that there are a number of factors that can be challenging, but certainly things like lettuce, you know, even growing spinach. And again, how do we get people to eat these? Don't wait until they're 16. They need to be introduced at, you know, from the 6th month when you do this complementary diet. Complement, as in making it complete and fulsome. These need to be introduced from that age. And I think if we could, you know, try to combat some of the obesogenic influences from, I would say, early childhood, you know, from the early childhood feeding component. So at the time where we introduce complementary foods all the way through our nursery and primary school programs, I think that would help. But also, and I think, again, the school policy is addressing this, what is available to children to eat on the school compound, on or around the school compound.
They spend a lot of the day in the school environment, so it's really important.
Opportunities for healthy eating should be maximized there.
But what about more policies starting from the very beginning? We're talking about from the moment baby is born, and we're talking about breastfeeding. Now, I mean, I think we could do more in terms of policy around increasing the rates of breastfeeding, encouraging moms to breastfeed more. What do you think about starting from there rather than starting from 6 months and onward?
Which is fine. I mean, if we look at the whole idea of, you know, the fact that mothers have maternity leave, and I think it's also how do you optimize your maternity leave? Because, you know, there's this, I would say, traditional saying you can start 6 weeks before you deliver and have 6 weeks after. But really and truly, if mothers are healthy, they can work up to the time they're ready to deliver. Because by the time you have the baby, you start to breastfeed, it takes time for, you know, the milk production to be established if you want to be expressing milk. And storing it, which is an important way for actually ensuring that when you do return to work, your child has a supply of expressed milk that they can have. So there's no need to go to formula per se. But I think how people actually take maternity leave can also, you know, so even some education around that. I know there have been discussions as to should we increase the level of maternity leave, which is a bigger policy discussion. But I think it might be useful to hear from the public what their thoughts are. Because if you look across the world, the countries that have better rates are typically countries where mothers have a longer time at home.
Absolutely. And it makes sense instinctively.
You know, but again, we still need to think about our context, you know, as a state, you know, our economies have some challenges. So it is define what really could be a win-win within our context and still be practical. But I think if we can optimize at least what we have for that 3 months, I think that's a good start.
But then what do you think
Sorry,
go ahead.
No, I'm saying also, you know, emphasizing that having fathers have time off or the partner having time off is very important because mothers need a lot of support during, especially those first few weeks of breastfeeding. It can be terrible.
Make or break, really.
You know, so having that supportive environment and having a partner there, that is important as well. So again, how do we optimize, you know, those opportunities?
And then as well, too, I think, I mean, we've had other people on the show, and I've put this to them as well in terms of extending maternity leave for mothers. I mean, I don't actually think that that's something that's going to be anything coming in our near future. So then what about breastfeeding workplace policy?
Right. So I was going to come on to that. We do have a national workplace wellness policy. For breastfeeding, there's a
national breastfeeding
policy. But again, policies are only as good as the extent to which they're implemented, monitored, and you know, and people are aware of them. So the question is, are people actually aware of the policy? And then the things that need to be done within workplaces, do people have the wherewithal? Do all workplaces have the wherewithal to implement these? So we recognize that some workplaces might be better able to, but I think there's not enough of a discussion around it. I don't think there's enough awareness of it.
Absolutely.
And as I would have mentioned, you know, earlier in the podcast, that, you know, it might be a case there are some workplaces I know, for example, you know, where they may have an opportunity to have a breastfeeding room. So mothers might be able to breastfeed, or they're flexible enough in terms of the work they do, the mothers can leave and go to the nursery and breastfeed. Or some might be able to just express the milk and store it. But again, something as simple as having a quiet place, a clean room, a fridge that's dedicated for the breast milk, because you know sometimes there's the whole issue of I don't want breast milk in the regular fridge,
absolutely,
and so on and so forth. So I just think the actual steps of getting some of the policy actions in place, more attention needs to be done to look at how to make it manageable and feasible. So the policy is fine, it is broad-based, but I think it is how do we So I think we need to revisit and make it how to implement the policy is probably where some emphasis, not probably, is where emphasis needs to come.
And then, as you said, to start with, sensitization, because you can have as many policies as you want, but if you don't have the players buying into the policy, it goes absolutely nowhere.
Definitely.
And then what do you think also about, because in my mind is towards, because we have been talking about breastfeeding workplace policy for a while now. And you do have some companies who actually think this is a good thing, and they've tried to implement different parts of the policy in their environment. But I kind of think that in order to be equitable, something like that, just like the International Code of Marketing of Breast Milk Substitutes, I think something like that probably needs to be legislated so that people don't get to pick and choose.
Agreed.
Whether or not all mothers in this country deserve to have breastfeeding workplace policy, a clean space, and whatever. I'm not saying that they all have to have it at the same level, because depending on what, if you only have 5 people in your office space, you can't have a big room and so on. But adapted to the environment.
Yeah, which is why I spoke about it could be done flexibly. So if in all of cases where his mother's, the baby is brought to mommy during the workplace.
I've never heard that one. Really?
But this was a private sector. It was a small setting, but it was a case where the person who ran the business was a good, a strong proponent for breastfeeding. But that was more the exception.
Yeah. Okay.
But I'm just saying, and I'm just really supporting the point you're making, is that there can be varying levels, but we recognize there's a minimum
standard
or a minimum set of opportunities that we provide for mothers to be able to breastfeed.
And I know, and this question also is probably the last question in terms of nurseries and healthcare. And I know we've had conversations about really and truthfully what more can be done in nurseries to help promote breastfeeding and create that environment for mummies. What do you think is the role for healthcare professionals and healthcare providers and nurseries in Barbados in terms of supporting breastfeeding?
I think healthcare providers need to also, in a sense, be cognizant that sometimes you can get discordant information coming.
I like how you said that.
So that can create, confusion or challenges for, the patient population that we look after. But I think, recognizing that breastfeeding is fundamentally important. And yes, while we will focus on NCDs, recognize that actually if we can promote more breastfeeding, we actually lay in the foundation to minimize the risk for NCDs.
Yeah.
And I think because of where we sit as health providers, so we're in a good space that we can demystify some of the thought patterns that are associated with breastfeeding, because some people are unsure whether the child, for example, is getting enough. So there are things that we can say, well, are there wet nappies? Is the child growing? Is the child seem content? There are different things that you can do to reassure mothers and fathers, especially new ones, that they're doing the correct thing and it's actually working. So in the ideal scenario where you had more of a focus on the well baby clinic within the public sector, for sure, that was what a lot of time was spent on, just reassuring, showing people the signs of growth and, just reaffirming their efforts. Unfortunately, for a number of reasons, including the COVID overlay, there's been a lot more emphasis now on catching up and dealing with the NCDs and some of the crises that we have. And maybe sometimes what happens, there's a shift from some of the preventive care, but I think if we can have more of a health promotion approach, with respect to maternal and child health, I recognize is a spectrum. So the healthy baby, it starts from prenatally all the way through, so good antenatal care, but even at the antenatal visit, start to speak about breastfeeding, and so that by the time the baby does come along, mothers are pretty much geared up.
Clued in,
And the family is also brought into the picture to help support the mother through
Very
this.
important.
And, I remember there was a time when there was more opportunity for nurses to be in the community, could actually go into homes and see what maybe some of the challenges. And it doesn't have to be a nurse per se. There are other categories of healthcare workers. So in other settings, there are community health aides. There are other people who can be trained to assist. Because when we think of public health, it's not just the clinical people or certified people, but there are other people within communities who can be brought in to support what we do. But I think though the oversight would come from the healthcare providers, and there are a lot of private practitioners who are very engaged in breastfeeding and supporting breastfeeding. So I don't want to make it sound like it's a public sector thing only, but I think all providers have the opportunity to teach, to support, and maybe we need to pool our resources maybe a little bit more. But also I think incorporating the nurseries, because there are some nurseries who play a big role because they do encourage mothers to bring in breast milk for their children, you know, whereas some are not quite so comfortable with it. So it might be an opportunity then. You have to, you know, do some teaching it, you know, I would say training, sensitization, and actually, you know, outlining the fact that there's nothing harmful to you if you handle breast milk, because there's a way to handle, you know, as breast milk as safe for the child and safe for you as the one who's looking after the child. So I think, and because nurseries tend to be the place too where the complementary feeding starts.
Absolutely.
Another area where training can focus and you can actually, you know, get children on the right path of eating. So I think it is a continuum, really starting in the home, starting, you know, extending to where children are managed, say, in nurseries, preschools, and then it will go all the way up through to the, you know, through the school system. So I think if we can see that it is an overlapping and a continuous type approach, that will be useful. And certainly I think both people who work in persons from healthcare and the nursery system can be advocates for breastfeeding.
Absolutely.
Because again, I think there's a lot of power that comes from hearing the voice of people who go through things and deal with it on a daily basis. You will hear the triumphs, but you'll also hear the challenges. But importantly, how do we surmount the challenges? Because I don't think people just want to hear, oh, it's good for you, it's good for you. They want to know what happens when my breast gets engorged. What happens when I'm so tired I don't feel like breastfeeding? So those supports are important.
And what you said is really key, because as both of us are healthcare providers, and I have to be honest with you, before I had my own children and before I breastfed my own children, I didn't understand my power, my role, let's say my role in supporting mothers in breastfeeding. I really didn't understand it. And I agree with you totally in that we actually have a lot more influence on maternal decision to breastfeed or not. So if you walk into your doctor's office and they're kind of, well, you could, you couldn't, maybe you do, you don't, and they really don't care if they're also getting messaging from the granny or someone else saying, well, you're starving, then guess what decision they're going to make. We really do hold a lot of influence over these.
We do.
And I really want that to come out from this podcast. That as healthcare providers, we need to step up a little bit more. Maybe get ourselves trained.
Also be willing to speak to family members. So I've had cases where, you know, a mother, she says, I brought my mother so you could talk to her. Because she's not listening to me, that type of thing.
I like that.
And, you know, it's always then trying to, you know, not to get too inserted into the family dynamics, but just to present information in a neutral way, but to try to understand the grandmother's concern and to allay her fears. Because I said, but, you know, so I took out the book, and I said, but you see, the child's weight is increasing. He's, you know, the milestones are being met, and but he cries all the time, but some babies are just fussy. So it is just to try, and I know we may not have the time to spend with every single parent like that, but that's what I'm saying, that we can think about how can we look at other members of the healthcare team, or, you know, how other people who can be part of the team of support for mothers. And peer support is important.
Absolutely.
You know, so I think that those are some of the things, you know, even strengthening communities of peer support would be important. We can be resource people.
Yeah, absolutely. I mean, this conversation has been really very, very, very fascinating. It's been really interesting. You've given a lot of information to our, hopefully, watchers and listeners. So thank you so much, Dr. Harewood, for coming and spending time with us on the couch for the Milk of the Matter.
It was a pleasure being here. Thanks so much, Alison. Thank you.
So thank you, viewers, for tuning in to this episode of The Milk of the Matter. And a special shout out to Nubian Naturals for sponsoring the show for us today. We'll see you again next time.